Oh, wow. I feel really good.
Yeah, good. All right, so you got a little low back pain, and it travels down here.
Yeah.
And it hits into your calf.
Yeah.
And you said like this spot is like the worst, right? Like
Yeah.
like when you're like trying to sleep and stuff. Like, okay, yeah. So you have a nerve that comes out of your low back, and it goes right into here. That nerve's pissed off. So I'm just gonna try to take the pressure off.
All right.
So this is typical sciatica. He works out a lot. Probably sometime he probably, oh man, you feel that?
Yeah.
He probably injured a disc in his low back at some point. Right now it's a little inflamed and it's pissing off the nerve. But I need to work on this stuff.
Oh, wow.
Yeah, I know. So these are your scalenes right here. These are actually accessory muscles of respiration, which means they do the breathing for you when you kind of have bad posture. So you're supposed to breathe through your belly here.
Okay.
But if you're doing chest breathing, your scalenes like to take control. So I'm just gonna try to reset them a little bit. Let me have you go face down. So if his discs are being pinched, if his nerves being pinched by the disc in here, it's gonna feel good if I pull his sacrum down because it's gonna open that space in there. You see like that? So if I'm pulling this down, it's opening all of these right here. That's what we want to do. We want to nourish that area. So what I'm gonna do is I'm gonna put these wedges here to do it for me while I do some muscle work. Lift here, and down. Do those feel even?
Oh, yeah.
Do they feel pretty good? Alright, good. So that literally just takes pressure off his low back. So now I want to get into these muscles a little bit. So I'm going to use some CBD cream here. Spreads pretty well, feels pretty good, smells good too. So here I'm getting into his QL muscle, Quadratus Lumborum. Just trying to reset the muscles, make sure there's nothing super tight so I can actually get in there and feel the joint, see exactly what's going on without the muscles kind of guarding it and protecting it. Okay, at first glance, there's a couple of spots here that are sticking out a little bit. So I'm just gonna kind of push them down. Just go ahead and relax your chest for me. Oh, perfect. So now I'm gonna use this massage gun here. Just kind of warm up your spine, okay? Just gonna get into some of your muscles and your glutes. And basically just warm up your spine. So, I just want to show you guys what I'm feeling for here. This is his neck up here, right? So we're looking at this spot. I'm just gonna take this out of the equation. Just don't think about this. Right now, when I push this way on this bone, it's really stuck. This one feels really good. It goes like this. This one's just like So I'm gonna try to give it some movement. Let me show you. Going this way is pretty good. This way, nothing. This way, good. It's like bouncy, yummy, nothing right there. So I'm gonna put my hand right there and just move his head over like this and kind of give him a little pop right there. Perfect. And then this one over here, he has a first rib that comes in right in here and wraps around to the front, and it's stuck. And you can tell by right here there's not a lot of movement, but if I go like this, everything bounces, no movement here. So I'm going to wrap my thumb around here, bring his head over, and pop it in. Good. You're doing great, dude.
Thanks, huh?
Right in here, it feels a little congested in here. So what I'm gonna do is I'm gonna take his leg, pull it down, and all this area should just kind of clear. So just go ahead and relax your leg, relax this spot like right in here too. Woo, that was loud. Okay, so what I'm gonna have you do is lay on your left side facing me. So I'm going right on L5. Right there. Perfect. Oh, perfect. Other side. Perfect. I don't know why everyone wants to stretch it. If you have a nerve that's pissed off, you don't want to stretch it. That's the last thing you want to do. So I'm going to show you something that I like to give my patients. It's called a floss. So basically, we're stretching that nerve and releasing it. Stretching, releasing. So instead of just stretching it, we're desensitizing the nerve. You do this over and over, 20, 30 times a day. It starts to feel a lot better. All right, let me have you go face down. So another one I'm gonna have you do is just face down. You're gonna have flat hands here, and you use your hands and your arms to push your torso up off the table. Perfect. Yeah, that's perfect. And then go down. So what this is doing is we're gonna be lubricating and hydrating the discs in the low back by doing this. And think about it. How often are we in this position where we're extended up like this? We're never in this position now. We gotta do it every now and then. Your body likes it. So with this, just make sure your butt and your low back are completely turned off. Up and down. So I'm gonna open that space a little bit up. Should be able to go further. Yep. Up and down. Perfect. Okay, go ahead and just flip over. Oh, and I don't believe in the whole short leg, long leg thing. Yeah, his right leg's a little shorter, but it doesn't mean anything to me. I don't believe that we're supposed to be symmetrical. I think we're asymmetric beings. It's fine. You got one leg that's shorter, whatever. What does it do? Yeah, those are good for your hip. Okay, yeah.
Oh yeah.
Well, yeah.
Appreciate it.
Yeah, oh yeah, dude. That was great. How do you feel? Do you feel it?
Dude, I feel really good.
Yeah,
right
good.
now.
So I know he didn't really feel it in the office, but this bugs him kind of like late at night. So
Yeah.
let's see how that does.
Oh yeah.
Do both those exercises. The push one, I want you to do it like 20 to 30 times,
Okay.
and it should not hurt. If it hurts, you're doing it too far, or it's just the wrong movement for you. So 20, 30 times, a couple times a day. And then the other one, do that one like right after that flossing one.
Yeah.
Do it like 10, 15 times right after. Okay. Yeah, hell yeah, dude.